Myself, Rajita. I welcome you to today's session. So, here we are going to discuss today regarding a very common and interesting topic, or we can say a disease condition, which is basically related to the cardiovascular system and it is affecting the circulation of the blood into the body. So, first, we are going to look into a real life case scenario through which we will try to guess the disease condition of today's. So, a 55 years old female presented to our outpatient department of a hospital with the chief complaint of angina that will be aggravated during the time of exertion, and the angina has been complained as a mild and which is basically present for as long as the duration of 6 months. Even the patient has been complained regarding the presence of intermittent claudication, mainly to the left lower extremity. The third complaint she's having is definitely exercise intolerance and a severe tingling sensation over the lower extremities. Now, while collecting the history, we got to know the person has been diagnosed with type 2 diabetes mellitus as well as hypertension for more than 10 years. So, she is basically a known case of hypertension as well as a type 2 diabetes mellitus. While collecting the subjective data, we have known that the person has continuously having a irregular medication therapy. So she was not adherent to the medications therapy, and while doing the diagnosis and while doing the physical examination, so on examination, the blood pressure was 150 by 84 mmHg, as well as there was problem or altered peripheral pulses over the left lower extremity. On examination, we have also found that there was a slight black discoloration over the tip of the toes into the lower limb. So, after doing the diagnosis, the person is diagnosed with a condition that is known as peripheral arterial disease or peripheral artery disease. So, I hope you got the idea that today, here in this session, we are going to discuss in detail about the condition of peripheral arterial disease. We will be discussing about the definition, the incidence of this condition of peripheral artery disease. We will be also reading about the etiological factors, the pathophysiology, or what is the process because of what the clinical manifestations are coming to the patient or presenting in the patient. We will be reading about each of the clinical manifestations as well as the diagnostic studies, even the management of peripheral artery disease. So let's get started with the definition of peripheral arterial disease. So before going to peripheral arterial disease definition, we should know that the peripheral artery disease, as the name itself is suggesting, it is nothing but a disease condition which is affecting the arteries. Basically, the arteries which are present into the peripheries. And in this case, we are going to see almost always the lower extremity of the individual will be affected. Now, in this peripheral arterial disease, we are going to see that there will be inflammation into the arterial wall, into the peripheries of the particular individual. And as the age is progressing, we are going to see for the old age people, the clinical manifestations will be very prominent associated with this condition. So very rarely we are going to see a young people or a young individual will be presenting with the clinical manifestations associated with peripheral arterial disease, because this disease condition is a slowly progressed disease. Peripheral artery disease also considered to be one of the major important marker which is suggesting a advanced systematic atherosclerosis related disease in the particular individual. Now this condition also will be associated with the etiological factors and the risk factors with other cardiovascular disease. So almost every time when a person or when an individual is presented with the clinical manifestations of peripheral artery disease, in every cases or majority of the cases, we are going to see even the person will be having a disease condition or may have a high risk of the disease condition related to the coronary artery disease as well as a cerebrovascular disease. So basically, this condition is suggesting a peripheral disorders of arteries we have known. Now, it is very much related to the other cardiovascular disease, mainly to the disorders of coronary artery disease or cerebrovascular disease. Now, this condition considered to be the major marker for suggesting a systemic atherosclerotic disorder for an individual person. So now we are going to read about the definition of peripheral arterial disease. So peripheral arterial disease is a systemic condition where we are going to see it will be affecting the circulatory system. So in this disease condition, there will be inflammation into the arterial wall, mainly to the peripheries, and which will be mainly related with the lower extremities circulation or blood vessels. And progressively, it will be causing occlusion of the peripheral arteries over the lower extremities as well as the narrowing of the arteries. So this narrowing of the arteries ultimately will be causing a disruption in the blood flow, which will be causing signs and symptoms to be present for a particular individual who is suffering from peripheral arterial disease. So I hope by the definition you understood that in this condition, mainly the peripheral arteries of the lower extremities will be affected. The second important point related to this disease condition is it will be causing occlusion of the arteries, basically the narrowing of the arteries. Now, narrowing of the arteries can be caused even by the atherosclerotic plaque formation over there. So ultimately, this pathological condition is causing diminished blood flow. That is the reason we are going to see the person will be present with very prominent signs and symptoms in a progressed stage associated with this condition. Now we are going to look into the incidence of peripheral artery disease. So in worldwide, 200 million people are presented with the condition of or diagnosed with the condition of peripheral artery disease. But it is to be noted, not even 10% of those people are showing a severe symptoms associated with this condition or complication associated with it. The clinical manifestations and the complication associated with the peripheral arterial disease is more commonly seen among the women. And also, the elderly people will be having more risk for the development of the signs and symptoms and complication related to peripheral arterial disease. Now we are going to talk about the exact etiological factor which is causing this disease of peripheral artery. So basically, you have to remember three things that this three major important point of etiological factor will be ultimately causing the development of signs and symptoms associated with this disease condition. Now, this etiological factors includes the atherosclerotic plaque formation, a progressive narrowing of the arteries or of the peripheral arteries, as well as inflammation and the injury of the peripheral arteries. So I hope you guys got the idea that in case of etiological factor, we are going to see three factors are playing the vital role in the development of peripheral artery disease. So the first is a inflammation or a injury to the peripheral arteries. The second one is obviously the atherosclerotic plaque formation. So already we have studied in coronary artery disease that the injury or the inflammation will be leading to the atherosclerotic plaque formation. So basically, the coronary artery disease and peripheral artery disease is almost similar, but the difference is that this condition will be taking place only or will be affecting only the arteries of the peripheries. Whereas in coronary artery disease, we have seen the disease progression is taking place only to the coronary artery or to the coronary circulation. So the same way the etiological factor, that is inflammation and injury, will be increasing the chances of the occlusion of the peripheral artery. So this will also lead to increased probability to development of atherosclerotic plaque in the peripheral artery, which ultimately will be causing the changes and will be presenting or will be causing the symptoms development for an individual person. The third mechanism or the third etiological factor is the narrowing of the artery. Now, because of any underlying disease condition or maybe a genetic or familial factor, if there is a abnormal narrowing of the peripheral artery, we are going to see the person will be present with the symptoms of peripheral arterial disease. So now we are going to talk about the risk factors in detail. So as I mentioned that the risk factors will be almost always similar to coronary artery disease. So you actually can compare this two disease condition and read it in an easy way. So risk factors for peripheral arterial disease includes certain disease condition or cardiovascular disease condition that includes the coronary artery disease, as well as it also includes the atherosclerotic or ischemic heart disease. So basically this, if a person is having a past history of coronary artery disease or ischemic heart disease, they will be considered to be have a more chance for the development of peripheral arterial disease. Other than cardiovascular disease, the risk factors will include a past history of diabetes mellitus, basically a prolonged history of diabetes mellitus, basically of type 2. A prolonged hypertension also will play a important or major role in the development of peripheral arterial disease. Hyperlipidemia also will be considered to be one of the major important factor for the development of peripheral arterial disease. Increased homocysteine level and increased C-reactive protein level in the body will be also considered to be as a risk factor for the development of this condition of peripheral arterial disease. So the condition of hypertriglyceridemia as well as obesity also plays a very vital role in the development of peripheral arterial disease. Hyperuricemia almost always will be related to the development of these conditions. Now we shall look into certain conditions which are basically considered to be non-modifiable risk factors. So we cannot actually modify these factors. So a person who have an inherited disease condition or maybe a genetic link, they will be having an increased chance for the development of peripheral arterial disease. Second, the person who are having a positive family history of peripheral artery disease, they are considered to be under high risk for the development of this condition. So as we have learned that this condition or increased age is almost always related to the development of symptoms and complication associated with this condition. That is the reason increased age is considered to be one of the most important non-modifiable risk factor associated with this condition development. An individual who is having a sedentary lifestyle or not having a proper exercise pattern, they also will be considered under a high risk for the development of these conditions. A person who is suffering from a prolonged psychological stress, or maybe if a person is having increased environmental stress, they are also to be considered under the risk factor for the development of peripheral arterial disease. Tobacco and alcohol consumption, or we can say a habit of tobacco and alcohol consumption, also to be considered one of the most important risk factor for this development of this condition. So I hope here we have learned about all the risk factors that are associated or that can be associated with the development of peripheral arterial disease. So first we have seen certain modifiable factors, even certain disorders related to the cardiovascular disease. Next we have seen certain conditions which are not related to the cardiovascular system. Next we have seen certain non-modifiable factors which are aggravating the development of peripheral arterial disease for the individual. Now we are going to discuss regarding how this etiological factors is ultimately affecting the peripheral arteries and causing the symptom development for a particular individual person. So let us study the pathophysiological process which almost always will be occurring for a particular individual who is presented with the symptoms of peripheral arterial disease. So we are going to see here most of the time this disorders or this disease condition will be affecting the blood circulation of the lower extremity. So majority of the cases, the affected part or the affected arteries in case of peripheral arterial disease will be including the femoral artery, the popliteal artery, the tibial artery, and the perineal artery. So these arteries are the most common arteries which will be almost always affected in case of peripheral arterial disease. Even an individual can be present with a combination of these affected arteries too. So for some patient, we are going to see one or more arteries will be involved in the disease process of peripheral arterial disease. So it is to be noted almost in every cases, if the individual is having a history of diabetes mellitus, who is presented with peripheral arterial disease will be definitely having the affected arteries below the knee. So if a person is having a history of diabetes mellitus, for them below the knee the arteries are more prone to get affected in this pathological process of peripheral arterial disease development. Femoral popliteal area are more common for those patients who are not having a history of diabetes, or for non-diabetic patient the popliteal femoral area in case of peripheral arterial disease is very common. Now, in case of an advanced level of this disease condition, we are definitely gonna see that multiple occlusion of the arteries into the periphery, mainly into the lower extremities, will be prominent. So that is the reason why the person will be having definitely very prominent sign and symptoms associated with peripheral arterial disease when it is in the advanced stage. So I hope you got the idea that that is how the peripheral arterial disease will be developed in a particular individual person. Now you have to remember we have read about all the etiological factors as well as the risk factors. This all combinedly will be causing a injury or inflammation to the arterial wall, and that is the reason why from there the inflammation will be causing narrowing of the lumen of the artery. Even it can lead to atherosclerotic plaque formation into the peripheral arteries. So ultimately, we are going to see that it will be slowly progressing, and ultimately, when the occlusion is more than 60% to 75%, and most important part of the arteries are occluded, the person will be present with the sign and symptoms associated with a disrupted or diminished blood flow into the cells of the lower extremities. So the severity of the clinical manifestations of peripheral arterial disease will be definitely depends on the location. So which location or which site of the body part or lower extremities arteries are involved in this disease progression, depending on that the person will be showing the clinical manifestations. The two other factors for showing or for development of clinical manifestations also include the extent of blockage as well as the collateral circulation present in that particular area. So basically, the extent of blockage of the artery into the periphery will be deciding the amount of blood flow to those areas. So suppose if the arteries are completely blocked, we are going to see the adequate amount of blood circulation won't be there into the distal cells or distal tissues in the extremities. That is the reason person will be developing with the symptoms. But in case if the artery is partially blocked, where these arteries are able to supply a minimum amount of blood to the tissues of the distal portion of the blockage, definitely we are going to see the person will not be showing very severe symptoms associated with these conditions. So that is how the extent of the blockage of the artery will be deciding the severity of the clinical manifestations. Even as we have learned, the peripheral arterial disease is basically considered to be a slowly progressed condition. So majority of the cases, the person will be suffering from other disease or other underlying conditions, and slowly and steadily this peripheral arterial disease will be developed. That is the reason most of the person will be having a well formed collateral circulation over the extremities. That is the reason this collateral circulation will be helping to maintain the adequate blood supply to the distal tissues of the blockage. So, if it is occurring in a slowly progressed manner, the person will not be showing very severe symptoms because of the collateral circulation. But if they are developing peripheral arterial disease in a high pace, definitely we are going to see the collateral circulation will not be adequately formed in that place. That is the reason the person have a chance to show the symptoms in a severe way. Now we are going to discuss regarding the classic symptoms of peripheral arterial disease. Now this include the intermittent claudication. Intermittent claudication, it means a muscle pain, or to be in a precise manner, it means that ischemic muscle pain. Now, intermittent claudication will be a classic symptoms for a patient who is suffering from peripheral arterial disease. Now, definitely those individuals will be having a increased muscle pain during the time of exercise or intense exercise. I hope the reason behind this is very clear, that as the exercise will be increasing the oxygen demand by the body tissues, but here what's happening is due to the blockage of the arteries, adequate amount of blood supply won't be there to those areas. That is the reason the oxygen demand, if it is increasing, will not be met via the circulation. So we are going to see the person will be showing the symptoms exaggerated way during the time of exercise. Now, this intermittent claudication almost always will be resolved within 10 minutes if a person is having adequate rest phase soon after doing the physical exercise. But remember, this intermittent claudication or the ischemic muscle pain is actually reproducible. So, most of the cases, or most commonly, we are going to see a person who is present with peripheral arterial disease will be complaining commonly about the claudication into the areas of buttocks and thighs. Now, this basically is indicating that the iliac artery is affected into the pathophysiological way of peripheral arterial disease. Claudication will be almost always indicating the femoral and popliteal arteries' involvement in the disease process. If the peripheral arterial disease is affecting the internal iliac artery, then we are going to see the person may present with a erectile dysfunction. So these are the major common areas which can be affected because of the peripheral arterial disease. And we are going to see the classic symptoms of intermittent claudication depending on which artery is involved in the disease process. The next common manifestations is paresthesia. Now, paresthesia basically suggests a numbness and a tingling sensation over the lower extremities, basically into the toes and to the feet. Now, this paresthesia will be complained from all the patients who are suffering from peripheral arterial disease. Basically, this paresthesia will be caused by a neuropathy. So, for the people or for the individual who are suffering from diabetes mellitus and who have a prolonged history of diabetes mellitus or diabetic neuropathy, for them the paresthesia is very prominent and severe. Now, even the person initially will be complaining of shooting and burning pain over the extremities because of the lack of the blood supply to those areas. Now, gradually their blood flow will be getting reduced. That is the reason why the neurons will be losing its deep pain sensation. Even the proper pressure over the lower extremities will be reduced. There is a reason the person may overlook if there is presence of any injury to the areas of lower extremities. So I hope you got the idea that in case of neuropathy, first there will be showing of shooting and burning pain. Even the person will be complaining about a paresthesia. Gradually and slowly, there will be completely reduction of the circulation of the blood to those areas. There is a reason why the neurons will be losing its ability to sense the deeper pain, as well as it will won't be able to maintain the adequate pressure into the lower extremities. There is a reason the person, as they're losing the deeper injury or pain sensation, even if the person is met with any injury to that lower extremities, they may overlook it until and unless they are intentionally observing their lower extremities. Now there will be a huge change into the physical appearance of the lower extremities. We are going to see a person who is suffering from peripheral arterial disease will often show a very shiny skin over the lower extremities with absolutely no hair present. The skin will be having an appearance of very thin and taut in nature. Almost always, the pedal, popliteal, and the femoral pulses will be diminished for those patients who are suffering with peripheral arterial disease. Now, this pulse will be diminished in a bit advanced stage of this disease condition. The elevation pallor is a very prominent indicator of the clinical manifestations associated with this condition. Elevation pallor basically suggests a pallor or a discoloration of the extremities, lower extremities, when it is elevated. Reactive hyperemia is also a very important clinical manifestations which will be suggesting the presence of peripheral arterial disease. Reactive hyperemia is nothing but a red coloration of the lower extremities when the extremities are placed in a dependent position. Now, as we have learned, the person even will be complaining about the pain and discomfort, which will be basically exaggerating during the time of exercise. Now, gradually, we are going to see this process or this pathological process of peripheral arterial disease will be involving the multiple arteries of the lower extremities too. There is a reason we are going to see in an advanced stage, even the person will be complaining the pain at rest. Now, rest pain is a very prominent indicator that the peripheral arterial disease has been progressed to advanced stage. Now, this rest pain will more likely to occur during the time of sleep. So what happens during the time of sleep? The person will be having a decreased cardiac output. That is the reason the rest pain will be exaggerating during the time of sleep or while the person is in a lying down position and in a resting state. That is the reason we are terming this condition as resting pain. The pain is more likely to progress when the person is putting their limb over a elevated position. Now, this will be occurring into the foots as well as into the toes as well. So, the person will be often complaining about the pains which will be mainly present over the foot and into the toes. In next stage, we are going to see if the persons are not getting any proper treatment in an advanced stage, the disease process will be further progressed and there will be discoloration of the skin mainly into the lower extremities, and it will be also affecting the part of toes and fingers tip. Now, discoloration of the tissues will be basically occurring because of the ischemia and necrosis that is affecting the tissues. So, as we have learned that there will be diminished blood circulation. So, the oxygen demand will not be met by the circulation of the blood. That is the reason the individual will be showing ischemic tissues present over the lower extremities. And as the tissues will be going for necrosis formation, we are going to definitely see the person will be present with a discoloration of the extremities. Slowly, the discoloration can be turned into a complete black coloration of the extremities, and ultimately, if there is presence of any injury or proper foot care, if it is not has been maintained, we are going to see there will be presence of ulceration, which even can lead to the form of gangrene. So we are going to see in a very severe stage the person will be present with ulceration as well as gangrene formation. So once the client is present with chronic rest pain, ulceration, and a gangrene over the lower extremity, we are going to term this condition as a critical limb ischemia. So in case of critical limb ischemia, first or initially the patient will be managed with a surgical or a revascularization therapy. Now, suppose if a person is not responsive to this surgical and revascularization therapy, we are going to see the medical therapies will also be used to manage the condition. But majority of the time, if the gangrene and ulceration formation is severe enough, even the amputation of the lower extremities can be done to manage the client. So we are going to see the peripheral pulses will be completely diminished and decreased. So initial stage peripheral pulse may be present, may be diminished, but present in the lower extremities. As this condition is increasing, we are going to see there will be a complete diminished peripheral pulses. The capillary refill time will be showing a duration of more than 3 seconds. So definitely the person's lower extremity will be having a very shiny and thin skin. There will not be presence of any hair over the lower extremities. Edema generally won't be present in case of peripheral arterial disease, but if the person is keeping their legs for a dependent position for a long duration, we may see the development of edema, pitting edema for those clients. So the location of the ulceration formation will be basically involving or commonly involving the part of the toes, even the foot or basically the tips of the foot, as well as malleolus area or the lateral malleolus. These are the very common position or location where the ulcer formation will be present in case of an individual who is suffering from peripheral arterial disease. The margin of the ulcer associated with peripheral arterial disease will be having a smooth structure, and also it will be having a round shape and will be as presented as a punched out area. Now, the drainage from this ulcer will be minimal. Initially, the ulcers will be containing a pale pink granulation. Severely, if it is affected, then we are going to see there will be black eschar will be present into the ulcers. So basically, we are going to see a mixture of pink granulations as well as a black eschar. Now, a person will have a intermittent claudication, even a chronic rest pain, but the person with peripheral arterial disease, if the lower extremities has been developed with ulceration, the person may or may not complain about any pain associated with the ulcer. So nails will be having a thickened nature, and the brittle nails are visible over the lower extremities, basically the parts which are affected. Now definitely we are going to see the skin color will be changed often. So the person with peripheral arterial disease often will be showing a dependent rubor and a elevated pallor. So it means that if a person is suffering from peripheral arterial disease, if they're having a position where the extremities or the lower extremities in a dependent position for long, we are going to see that there will be change in the coloration. So rubor basically means the extremities will be having a red coloration there. So suppose a person is sitting and dangling their legs for a long time into a chair or into a bedside, we are going to see the person's extremities will be having a red coloration. Whereas if a person is keeping their legs in an elevated position, we are going to see there will be presence of pallor associated with it. So elevated pallor and dependent rubor is a very common factor or very common symptoms associated with peripheral arterial disease. So already we have discussed the skin texture will be very thin and shiny, and temperature of that area will be cool. So these are all the indicators that the person is having or the person may suffer from peripheral arterial disease. Now, as we have seen this disease condition or the pathophysiology of it basically affecting the circulation of the blood to the areas or to the tissues of the lower extremities. Definitely, we are going to see certain complications which are very often associated with peripheral arterial disease. Now, as we have mentioned, the person will be having neuropathy because most of the people who are having a progressed condition or history of diabetes, for them, the development of peripheral arterial disease is very common. That is the reason we are going to see the person may overlook the injury. That is the reason why there will be presence of ulceration formation, even that ultimately can lead to the development of gangrene. So that is the reason a person who is suffering from diabetes and a peripheral arterial disease and are overlooking their fit and not getting a proper foot care or initial treatment, we are going to see for them the complication development is very authentic. So, as an initial complication, we are going to see the person may be present with atrophy of the skin and of the muscles of that particular area over the lower extremities. Even a small injury, if it is taking place, will be taking a lot of time to heal. So basically, a delayed wound healing also considered to be a major complication associated with peripheral arterial disease. Wound infection is very common because even a small injury can develop to a very huge wound which will be infected because of the abrupted blood flow and blood circulation to those areas. Tissue necrosis often will be associated with if the person is even having a history of diabetes mellitus. So already we have discussed regarding the ulcer formation. So ischemic ulcer also will be formed over the lower extremities, basically over the bony prominences. Severe infections and gangrene formation and ulceration is one of the major important complication associated with peripheral arterial disease. And next is if the person has to undergo the amputation. So amputation is also considered to be a complication which will be done if the person is not managed with any conservative and medical therapy for peripheral arterial disease. Now, basically, the past and present health history will be involving all the details regarding a patient's present medical history. So, this will be helping a medical professional to identify whether the person is having a disease process related to the cardiovascular system, which is uh, considered to increase the chances of development of peripheral arterial disease, as well as the history collection will be showing or the past and present history collection will be showing if the person have a previous history of ischemic heart disease or coronary artery disease. So basically this information will be indicating whether the person is having a high chance for the development of peripheral arterial disease. The next history includes a family history. So basically, it will be the medical professionals will be asking the patient about a positive family history. It is to be considered that if a person is having a positive family history, for them, they are considered to be under a high risk for the development of this disease condition. Also, noting down of the age, the simultaneous lifestyle, as well as their gender will help a medical professional to decide if the person is having high chance for the development of this disease condition. So age, gender will be collected, as well as it has to be noted the lifestyle of the particular individual. So basically lifestyle includes the dietary intake, the habits of tobacco or alcohol consumption, any habits of illicit drug use, as well as it will be involving the details related to the exercise pattern of the patient, even any psychological stress, whether it is present or not. So this details history collection will be definitely helping them to suggest the client to go for further investigation method to find out or to conclude the diagnosis of peripheral arterial disease. Next includes the physical examination. So as we have learned about each and every sign and symptoms, we have learned the person will be having very prominent symptoms of intermittent claudication, elevated pallor, as well as dependent rubor, as well as there may be presence of ulceration or discoloration of the tissues over the lower extremities. Now, while doing physical examination, this all details has to be focusedly collected to find out whether the symptoms are showing or indicating a progressed stage of arterial disease or peripheral arterial disease or not. Palpation of the peripheral pulses over the lower extremities, like popliteal pulse, even the femoral pulse, will be very helpful to understand whether the pulse are diminished into the lower extremity. Next, we are going to discuss regarding the diagnostic procedures which are often used to conclude the diagnosis of peripheral artery disease. Now, once the person is presented with the symptoms which are indicating, a general history collection and physical examination will help a medical professional to understand the need of further diagnostic procedure. Basically, we are going to see the usage of Doppler ultrasound studies as well as the duplex imaging. So, duplex imaging and the Doppler ultrasound studies help to find out the circulation over the lower extremities or whether there is any changes into the circulation or artery. That has to be found out through this particular procedure or through this diagnostic procedure. Next, we are going to see the use of angiography even. So angiography will also helps to identify the exact area of blockage of the artery, which will be showing if the person is showing the symptoms associated with a blockage of the artery or there is presence of any narrowing of the arteries. As well as this angiography will be helping to find out the exact location of this condition. Magnetic resonance imaging also plays a very vital role to find out the condition or to find out or to conclude the disease condition or diagnosis of peripheral arterial disease. So, ankle brachial index. Ankle brachial index basically plays a very vital role to find out the involvement of the lower extremities into the process of peripheral arterial disease. So, this all diagnostic procedures will be done to confirm the diagnosis of peripheral arterial disease. Now, once the person is diagnosed with this condition, we are going to see the collaborative care will be provided to the client in order to maintain their lifestyle as well as to prevent the complication and any life-threatening scenario development. So the basic goal of the collaborative care includes the risk factor modification, as well as it will be also including the drug therapy to control the underlying conditions as lifestyle modifications. So basically, as we have learned, the risk factors almost always will be similar with coronary artery disease. So lifestyle modifications and the drug therapy to control those conditions plays a very vital role in order to prevent this development of peripheral arterial disease in an initial phase. So identifying the high risk population plays a very vital role. So if a person is having a history, a positive family history, and the history of diabetes mellitus, hypertension, or any cardiovascular disease that can be associated with the development of peripheral arterial disease, for those people, the collaborative care should definitely be provided at an initial phase in order to prevent the development of disease condition. So we are going to read about the health promotive measures in next. So now we are going to discuss in detail about the drug therapies which are often used to treat the condition of underlying disease conditions which may be associated with the development of peripheral arterial disease as a risk factor modification. So, pharmacological therapy will be provided or prescribed if a person is having a prolonged diabetes mellitus. Controlling of diabetes mellitus, controlling of hypertension with the pharmacological management plays a very vital role in case of the prevention or risk factor modification for peripheral arterial disease. If a person is having hyperlipidemia, proper drug therapy with an anti-lipid drug or maybe an anti-platelet drug plays a very vital role in managing the lipid level in a normal human being. So this drug therapy will be basically controlling the underlying disease condition, which is actually helping the individual not to develop with the condition of peripheral arterial disease. So, in drug therapy, anticoagulants are basically not recommended here, but antiplatelet drugs may be provided if a person is having a very high chance for the development of this disease condition. If not contraindicated, then only this could be prescribed to a person. So drug therapy plays here a vital role. Now we are going to read about the second factor of the risk factor modification, that is your lifestyle changes. So lifestyle changes also includes the cessation of the tobacco and alcohol consumption. And next is a diet modification. The third point is a very good physical activity or exercise, as well as the fourth includes the stress management. So basically, this all points that includes the cessation of the tobacco and alcohol consumption, the dietary intake, the exercise, and stress management. This all things play a very important role managing the client for who are having a high chance for the development of peripheral artery disease. Basically, the tobacco and alcohol considered to be those agents which affects directly to the arteries. That is the reason the cessation of this agent will also helps to improve the circulation, or it also will be preventing the chances of the development of peripheral arterial disease. A proper dietary intake will be helping the client to manage the conditions like hypertension, diabetes mellitus, hyperlipidemia. So it is to be suggested to intake more amount of fruits and vegetables and avoid all the junk food, simple sugar, even a very high fatty food. Now, for stress management, it is very important because, as we have learned, the stressful environment can also increase the chances of the development of, atherosclerosis formation or maybe narrowing of the arteries. So, stress management by doing a relaxation techniques or by doing a deep breathing exercise also helps the person to overcome the condition development of peripheral arterial disease. Physical activities plays a very important role. Even if the person has developed with a peripheral arterial disease, the physical activities will be actually helping to maintain the normal activity level for the client who is already diagnosed with this condition. So exercise therapy, as I have told, that it plays a very vital and important role to reduce the intermittent claudication, the classic symptoms of peripheral arterial disease as well. So smoking cessation and supervised formal exercise training plays a very vital role in case of prevention of this disease condition. It also improves the walking ability of the patient even if they are developed with peripheral arterial disease. Even after the surgical interventions, the exercise therapy should be provided to client to maintenance of their ability to work or functional ability. Now, we are going to see slow progressive physical activity will be suggested to the client depending on their tolerance. Basically, it will be followed by a warm up session. Now, walking should be continued for 30 to 40 minutes per day, at least 3 to 5 days per week. This is the basic and general guideline that has to be provided for the client who is suffering from peripheral arterial disease to maintain their functional and walking ability. Nutritional therapy, as I have mentioned, it includes intake of high level of fruits and vegetables, even the whole grains, which will be actually helping to decrease the chances of the development of hyperlipidemia. Now, low cholesterol intake and saturated fat intake and salt intake should be restricted for those clients who are having high risk or who are already developed with peripheral arterial disease. Now, generally, if a person is present with a critical limb ischemia, already we have learned that it will be characterized by a chronic rest pain, as well as there will be presence of intermittent claudication and ulceration and gangrene. So, if it is present for more than 2 weeks, or the chronic rest pains are present for more than 2 weeks, we are going to see there will be presence even of the ulcer and gangrene as well. So, care of the feet for those patients plays a very important role to manage the client with this condition. If the conservative management or caring of the foot and managing the other risk factors is not having a good response, or if the person is not responding to this conservative management, then maybe a revascularization surgery or therapy can be provided via a bypass graft surgery or a endovascular revascularization therapy. So once the person is unresponsive to the conservative management, then only it would be suggested for them to go under a revascularization therapy. Percutaneous transluminal angioplasty also will be preferred to manage the client with peripheral arterial disease, basically to remove the blockage here. If surgery and the percutaneous transluminal angioplasty is contraindicated for the patient, we are going to see the use of prostanoids for the client as a medical therapy, which will be helping to reduce the progression of ulcer as well as managing the symptoms for the patient. Antiplatelet therapy often will be provided even if this person is going under a surgical technique to manage the condition of peripheral arterial disease. Antiplatelet drugs basically will be prescribed to those people who are not having any contraindication. It plays a very important role to prevent the reoccurrence of the condition of peripheral arterial disease. Now, the conservative management includes, as we have noted, the care of foot. So basically, it includes protecting the extremities from any trauma and decreasing the ischemic pain over the extremities, as well as preventing and controlling the infection and ischemia, and improving the perfusion into the peripheral artery or into the peripheries of the lower extremities. So care of the foot will definitely include a proper inspection of the foot and the toe, even to the nails daily. It will be also including a proper cleansing of the lower extremities, as well as providing a proper lubrication for the lower extremities. As in case of peripheral artery disease, the person will show a very dry skin. A proper lubrication will be plays a very important role to manage the client with this condition. So the person should be instructed to avoid soaking of the legs, because it will turn or it will increase the chances of the maceration development. If there is presence of ulcer, a proper care for the ulcer should be provided. It should be covered with a dry and sterile dressing. Maintain of the hygiene and cleanliness plays here a very important role to prevent the chances of the development of infection. Wound care also will be suggested to the client, or a proper follow-up to provide care to the wound is suggested to those clients who are having a moderate to severe ulceration and gangrene present. So it is to be suggested for the client to avoid extreme heat or cold temperature to those areas where already there is presence of ulcer and gangrene, or maybe the person has a presence of progressed peripheral arterial disease. It is to be suggested for the client to wear a very soft and protective wear over the lower extremities. The heel area of the lower extremity should be protected from the pressure. We are going to see sometimes if the person is having increased pain, opioid administration will be suggested, and the person will be kept in a reverse Trendelenburg position. Now, this Trendelenburg position will be basically improving the circulation into the lower extremities, so which will be dealing or decreasing the chances of the development of pain and associated symptoms. Spinal cord stimulation also will be done if a person is having a severe pain which is not managed with a proper positioning as well as a medical therapy. So these are all the conservative management. which will be primarily provided to the client to manage the symptoms and decrease the disease progression. But sometimes the person will not be responsive enough towards the conservative management. So for those persons who are unresponsive to the conservative management, for them we are going to see the use of minimal surgery or a proper surgical technique. So the first minimal surgical technique, which includes the interventional radiology catheter based procedure. It includes the it's similar to the angioplasty procedure, what we have studied in coronary artery disease. So here basically a percutaneous transluminal angioplasty will be done, where there will be usage of a catheter will be done, which will be containing a cylindrical balloons. Now these balloons will be inserted to the area where the blockage is present, and this balloon will be inflamed, which will be ultimately compressing the atherosclerotic plaque of the area and will be removing the blockage from the artery. This also will help to revascularize to those areas which has been affected because of peripheral arterial disease. Next, we are going to see the use of stents. Even sometimes associated with percutaneous transluminal angioplasty, we are going to see the usage of stent. The stent will be basically made up of Dacron or a drug-eluting material. Now this agent will be similarly like balloon will be placed into the area where the blockage is being happened. So if the stent is put there into the artery where the blockage is present, definitely it is going to clear the blocked area, as well as it will be recovering the blood circulation to those areas into the extremities. Atherectomy plays a very important role here because it will be helping to remove the plaque, and if there is presence of plaque, we are going to see the use of directional, laser and rotational atherectomy as well. Cryoplasty will be done with a procedure of percutaneous transluminal angioplasty. Now cryoplasty will be basically providing a very cold temperature via a balloon which will be consisting of liquid nitrogen. Now this cold therapy will be helping to remove the blockage or remove the atherosclerotic plaque that has been formed into the peripheral arteries. So basically the surgical therapy will include a peripheral arterial bypass grafting. So peripheral arterial bypass grafting will be done with the autogenous or a synthetic graft replacement. So often the percutaneous transluminal angioplasty will be done in a combination with the peripheral arterial bypass grafting surgery. So basically we are going to see the surgery even can be as an enterectomy. So enterectomy, even the surgical procedure of enterectomy will be consisting of a procedure where the opening of the artery will be done to remove the obstruction. Next, the patch of the graft will be placed over there. So basically the patch graft angioplasty will be done where the opening of the artery and removal of the plaque will be done there. Then the sieving of the patch will be done via a widened open lumen. So there are certain few procedures other than peripheral arterial bypass grafting. So enterectomy is one of the most common procedure which will be done where the opening of the artery will be done and removal of the plaque will be performed. In next procedure where it is known as the patch graft angioplasty. So basically in patch graft angioplasty, we are going to see there will be opening of the artery, removal of the plaque or blockage will be done. Next, there will be sewing of the patch with a synthetic graft in the arteries where the incision has been made. So this three procedure is basically used to manage the client with peripheral arterial disease. Now, the next procedure definitely will be done for those clients who are having a severely extent condition development of peripheral arterial disease, and the patient will not be having any chance for the recovery for those parts of the lower extremities which has been affected because of the altered circulation. So basically this procedure of amputation will be done for those clients who have developed with a severe gangrene and ulcer which is not recoverable. So amputation is nothing but cutting off the body part which has been gone under a complete deterioration. So in order to maintain the life, definitely the amputation will be performed for those clients who are having a severely progressed condition of peripheral artery disease and who are not responsive to those conservative management, as well as who are not considered to be a perfect candidate for going under any medical therapy as well as the surgical therapy. So pharmacological management will be provided even in the preoperative and in the post-operative phase. This pharmacological management will be basically helping the person to reduce with the sign and symptoms that has been developed for them. So now we are going to discuss regarding the nursing management of these conditions. So basically nursing management includes first a detailed history collection and physical examination as we have seen before. Now nursing diagnosis will be basically focusing on ineffective peripheral perfusion or tissue perfusion. So this nursing care will be basically prioritize the condition. It will be already focusing on, or it will be having a goal to increase the perfusion into the lower extremities, as well as maintenance of the activity or daily activity of living should be ensured by the nurses. So the goal is always to maintain the adequate tissue perfusion for the patient. Relief of pain should be ensured. Increased exercise tolerance will be ensured by the nursing interventions, as well as intact healthy skin over the lower extremity should be ensured by the nurse. So the nursing roles depends on the phase which extent the person is present with the disease progression. So first and foremost important nursing role is to the health promotion. So health promotion, our nurses would be generally suggesting the client to go for a diet modifications, exercise, as well as avoid any injury, even managing the stress. So this all nursing health promotive activities basically helps to decrease or to manage the risk factors that is mainly associated with the development of this disease condition. We are also going to see the nursing interventions include the pre-surgical interventions where the care of extremities will be done. A proper observation of the lower extremity should be done here. The post-surgical interventions include the observation of the extremities clearly for every 15 minutes for at least 24 hours soon after the surgical procedure. Color, temperature, the capillary refill, as well as presence of peripheral pulses should be observed. The person should be measured for hemodynamic stability, as well as their vital signs should be measured at a regular interval. Aggressive pain management may be needed because some person will be showing a opioid tolerance because of a prolonged usage of these medications. Check for the perfusion and extremities coloration is very much important because it would be showing whether the person is having a progressed disease state. So even the assessment of the complication should be done. Any presence of hemorrhage, presence of any signs related to the infections should be informed to the physician as early as possible. Knee flexed position should be avoided if it is not required while doing the physical activity or exercise. Supine position with a leg elevation is generally provided in a post-surgical phase. So it is a proper positioning and a calm and quiet environment should be provided or should be ensured by the nurse towards a client. Walking should be encouraged after a day of the surgery. Sitting position should be avoided as much as possible after the surgery for those clients who are suffering from peripheral arterial disease. Wound care and hygiene plays a very important role here for managing the client and prevention of the complications. Home care include a health promotion as well as the nurse should explain the caregiver and the patient regarding to the adherence to the treatment therapies that has been prescribed. Majority of the person will be getting an anti-platelet drug regimen after the surgery. So adherence and the importance of it should be described to the caregiver and to the patient. The importance of the wound care, a proper positioning, A pacing of a rest and sleep and activity should be explained to the caregiver and to the patient, as well as it is a nurse's role to explain all the procedure that has been performed, the essentiality of it, as well as the probable and expected outcome of it should be described to the client and to the caregiver. And the last but not the least, it is a nurse's role to provide a psychological support to the client in order to manage the stress and psychological suffering, in order to promote a good healing of the surgery, or to help the client to recover from the condition of peripheral arterial disease. So I hope till here you have understood the whole topic of peripheral arterial disease. Thank you for attending the class. We'll meet you guys in the next session.